Hallux valgus refers to a deformity of the big toe. Most often we know this as a bunion. The definition of hallux valgus is a medial deviation of the hallux, the proximal phalanx, and the first metatarsal, resulting in a valgus deformity, which you can see in this picture. The mechanism of injury can be twofold. When we look at injury, oftentimes it's simply because of the shoes that the individual wears. If there is an increased pressure, it will form a callus, which eventually causes a bursa to enlarge. This creates an exostosis formation, exostosis being a bony formation, which then leads to that bunion. Additionally, about 80% of metatarsals are considered primus varus, which means they have a greater than 15-degree angle of the first metatarsal. So then you end up with folks having problems who have this issue, as well as those who have dorsiflexed first rays and forefoot varus. Signs and symptoms, again, are going to be that valgus deformity, some type of bunion formation, and those individuals tend to have pain and point tenderness at that MTP joint. The special tests that are used are more diagnostic tests. One thing that can be used or looked at is the intermetatarsal angle, through use of an X-ray, and we are looking for that metatarsal primus varus. You can see here that if it is about 8 to 20 degrees, it's considered normal, and as you go further away from that, you can see it becomes more pathological. The manual muscle tests that we will do for this include the extensor hallucis longus and the flexor hallucis longus muscle test. Treatment is usually going to be done with some type of donut pad. If it is severe enough, there can also be a surgical alignment that occurs that is a realignment of the metatarsal. This is called a bunionectomy. You may also see something that is very similar, but it involves the fifth digit. This is called a bunionette, and it's also called a tailor's bunion, simply because back in the day when tailors sit cross-legged on their tables and on that fifth metatarsal, and that would lead to that bunion. Bunion taping is done to help align that first toe with the first ray of the foot. Now, this foot that I'm going to demonstrate it on obviously doesn't have a bunion, kind of has a bunionette, but at any point, it doesn't really have a bunion, but it still is going to demonstrate pretty well how you would tape for a bunion, very similar to a turf toe. You're going to start with two anchors, one that's going to go around the foot, and then you've got the one anchor that's going between the first and second toe. Make sure that you do fold your tape so that you don't create some type of tape cut. You're then going to create spicas. Those spicas need to cross at the point of the bunion. Depending on the size of the foot, you are going to add 2 to 3, maybe even 4 spicas. Remember, the role of the spica is to apply some pressure to that big toe and pull it out in line to help decrease the pressure on the bunion. Once you have the spicas in place, you then are going to add another layer. This layer will be just of straight pieces of tape that are going to, again, help pull that big toe in line with the first ray. These pieces of tape are going to start distally and be pulled proximally. Again, you're going to kind of work your way around the toe, so you have maybe 3 pieces from that side to the front and a total of 1 or 2 in the back. The size of the toe is going to really dictate how many pieces of tape that you need to add here. Regardless, as you can see, that tape is starting to pull that first toe away from the second toe, which is going to help maintain that length and really protect that bunion in a way. Once you have added those strips, you're simply going to close in those pieces of tape to help prevent any type of rolling to occur when the person puts on their sock. These pieces of tape are just laid down. They are not pulling, pushing, doing anything to support the toe at all. Once you have closed those in, you can add one more anchor strip between the two toes, and then one more anchor strip around the foot. This is one of those tape jobs that you need to make sure that your athlete knows they have to peel off the pieces one by one, or they're going to have problems taking it off.